Another thing that is another option, because again, we're looking at all the different um, modalities that we can use to help slow down. Not everybody can use a contact lens. Not everybody can do the vision therapy. Not everybody can do the therapeutic eyeglasses. So what are other things? So another thing that we've been looking at in the studies is the use of an eye drop called Atropine. Atropine, those of you who might have heard of it before, will know that this is one of the drops that we may use to dilate your eyes when you're coming in for an eye exam. And so we're actually studying, the use of these types of medications to help slow down the progression. And so the major one that of the studies was 3 different doses. And what the goal of the study was to look at the how that impacted accommodation. Accommodation is my ability to focus. Can I focus? Can I relax my focusing when I look at the whiteboard versus can I increase my focusing when I'm looking at my book? And then can I go back and forth very readily? We also wanted to look at that in how much would that impact the size of the pupil, right? Because this is a dilating eye drop, right? So we wanted to make sure, is it really making the eyes too big, so that now am I concerned about that the eye is growing and growing? And definitely by the eye growing and growing, is it controlling the nearsightedness or that myopia? And then also, what are the side effects that these eye drops are causing, so that it can be successful or not, right? So here's the atropine drop. We looked at the clarity of the vision. We found out that it wasn't affected in the distance. We looked at the quality of life overall. The studies are also showing that it really doesn't impact that. And we looked at different concentrations. We looked at the major 3 concentrations. We looked at 0.05, 0.1, 0.2, 0.25, and so on. And so we're looking at seeing which are ones, the lower ones. Can we give a lowered concentration so that it minimizes the side effects, but also doesn't minimize the therapeutic effect? And so making sure of those things. And so the major ones that we are, like I said, evaluating are the 0.05, 0.25, and the 0.01. And so looking at the studies, it looks promising that this is another modality, another tool that we can use as an option to help slow down that nearsightedness progression.